I believe you have very good concentration and attention. If you have clouding of the concentration, then it is called a delirium. Myself Sukumar, I am the student of occupational therapy. Delirium is a neurocognitive disorder. Neuro means it is involved in nerves, and cognitive means there is a problem in thinking. So, in delirium, difficulty in concentration, attention, focus, and difficulty in straightforward stream of thought. Some person having delirium after some withdrawal, example medication withdrawal, drug withdrawal, alcohol withdrawal, they used to drink alcohol and they addicted to it, and they suddenly withdraw it, then the person may have delirium. So this withdrawal is a factor for delirium, or some person have metabolism problem. So there is a imbalance in the metabolism. That person also have the chance to get delirium. Some person may get delirium due to severe or chronic medical illness. Okay, what are all the signs and symptoms of delirium? I already said there is a disturbance in attention. So the person cannot sustainably focus. They can't shift attention from one thing to another thing. So they have clouding of consciousness. So simply we can remember as a problem in attention. Next, when we talk with him, they may repeat the same question and again. So they have a attention problem. They didn't hear correctly. Then they ask the same question again and again in different ways. They can easily distracted by any irrelevant stimuli. If we are talking about the delirium problem, if you see any other irrelevant stimuli from the any other side, so you can easily distract, then you have a delirium. But we are all having some focus. So even though we are trapped by some attention grabbers, but this person is not having that focus. Then they have a disturbance of awareness of the environment and time. So in which time I am standing here, in which time I am going to sleep, in which environment I am there. So these awareness are not present or disturbed in these persons. The signs and symptoms may begin acutely, which means after a nerve problem, after any withdrawal, it starts acutely. In few hours or in few days. The delirium is not stable all the day. So sometimes the person have attention, sometimes they have clouding of consciousness, sometimes they have very good consciousness, and sometimes, so it is a fluctuating. So the person in sometimes they have no symptoms, but in sometimes they have severe symptoms. So the delirium is fluctuating throughout the day. The symptoms are very worse in night time, because when it's dark, the person may feel these are all unfamiliar to me. That like they feel, so they have very lack of attention. They also have cognitive impairment, which means their thinking skills are impaired, and they have some emotional disturbance, which means they may fail to serve the emotions or fail to empathy, get the empathy of the other person. That emotional disturbance are present, and behavioral changes. The person may behave wrongly or behave inappropriate way, or they have chance to don't care about some important things that like behavior or arise. Okay, let's discuss about types of delirium. Is three types: hypoactive delirium, hyperactive delirium, mixed delirium. Hypoactive delirium is common. So hypoactive and mixed are most common. It has 80% of all delirium. And the hyperactive delirium is only 20%. It is less common. Okay, hypoactive. The meaning itself says the person have lack of active, which means they have many more nap, means short time sleep. So they may frequently doing the naps. So they wake and having the cloudiness thought, and they again nap and again stand. That like they routine the napping behavior, which means they also have chance to miss meals, miss medication, miss appointment. They booked some appointment and they have chance to miss because of the this napping problem. And during napping and after napping, the person may have chance to lack attention, and even they are waked, then also the person have chance to lack their attention, and they can't sustain the focus, and they can't have the sustained attention. These persons don't ask for attention from others, so they having nap and they having loss of attention, so they don't want any other person attention towards him. In hyperactive delirium, the person may aggressive, the person may argumentative, which means if we talk with him, they may get argument, and if we say something, they don't cooperate, they have uncooperative behavior. So these are all the hyperactive delirium. So if we enter into the room of the person is having the hyperactive delirium, we can easily notice the person because the person is very active and they can easily grab the attention of the therapist also because they are difficult to care. Mixed delirium. In this, hypoactive and hyperactive are quickly switch back, which means now the person having hypoactive delirium. Suddenly the person may have aggression and they can make noise and uncooperative to others that like. In hypoactive, they don't care about any others, they have nap and they simply inattentive. What are all the causes of delirium? The brain is sending and receiving the signals. So if any problem in sending and receiving the signals in brain, then it causes the delirium. This delirium may have one or more cause at a time. So the person may have a medication toxicity and have a medical condition. So this medical condition also contribute to the delirium and this medication toxicity also contribute to the delirium. So multi-cause the delirium can be have. Francis and their colleagues identified in elderly persons there are 5 main causes to cause the delirium. What are all the 5 causes? First, fluid or electrolyte disturbance. The person may have any fluid water problem or any electrolyte sodium, potassium, any electrolyte problem in their body that leads to metabolic disorder that may cause the delirium. Then infection. So the person may have any infection that affects brain or brain signal processing centers. Then it causes the delirium. Medication toxicity. The person having more medication than normal dosage, the person may also have the chance to get delirium. And metabolism derangement. There is a problem in the metabolism, normal metabolism. The fluid is correct, but there is a metabolism problem. That also leads to the delirium. And sensory and environmental disturbance. Sensory means there are 5 senses that collecting the information from the environment. There may be a problem in the sensation or there is a environmental problem. These two are sent to the brain. So sensation, what are all happening in the environment is seen by our sensation and it go to the brain. So if there is a problem in the sensation or problem in the environment, it also leads to delirium. What is the difference between dementia and delirium? In delirium, the person have fluctuating problem. So in morning they have very good attention. After that, sometimes they have a napping and they have a lack of attention. After that, like that. In dementia, it is a non-fluctuating. They have a memory, low memory. So it is chronic. So delirium is acute, which means it comes suddenly. But dementia is chronic, which means it progressively decaying the memories. We can notice the delirium person have confused or disorganized speech also. I am organized speech. I giving organized speech. I think, but it may be disorganized like that. So delirium person have accurately disorganized speech. So simply you can remember the alertness and attention is wax and wane in the delirium. We'll see dementia and other neurocognitive disturbances in our next videos. Thanks for watching. Be proud to watch our video. Don't forget to subscribe. I also need motivation.